This is Mariam, and she's concerned about what?
Gravity setting in, droopy face,
Okay.
wrinkles.
And that's what a lot of people are thinking, is that as we age, our faces droop and get longer in gravity, but in reality, your face doesn't get any longer. What happens is we lose volume in our upper face. When the volume's gone, then the face drops. Okay, so in some cases, somebody has a massive weight loss, their skin might drop, but they lost fat. And as we age, you lose your deep fat pockets. You know, if you go to church, you look at daughter, mother, grandmother, you see a progressive hollowness of the upper face and mid face and heaviness down here. So it is gravity, but it's gravity result of fat atrophy. So we're going to do filler in this area here, right in the temple, right down the bone, basically. A lot of mid-face hollowness. So I'm going to basically fill up this entire area. And also to get her neck lifted up, we're going to elongate her jaw. So you lose a little bit of dentition, a little bit of bone. And she's going to do her lips. I'm going to do her lips last. I like to numb up for the lips. And for the movie, if I numb her up for the lips, her lips will be kind of crooked and her face will be crooked. Okay? We'll do a little bit in here and a little bit in here. We'll probably do a little bit in her tear trough. But mostly we'll focus on building up her mid-face. So I'm just going to wash this off and then. So this fortunately is Crayola, so it comes right off. So we're going to be doing all bolus injections just to simulate fat deposits. We're putting it nice and deep where the fat pockets go. When I first started doing filler, we were doing everything really super close to the skin in order to economize the filler, but now we're doing things much deeper. So here we have, let me just grab my box there. Here's a box of reconstituted Juvederm. Basically, we take the Juvederm and we mix it with saline to make it softer, and I'll use that for some of the areas. In other areas, I use the full thickness Juvederm. And how I make the decision is based on if I'm going close to the skin, if I'm going to some place that a lot of stiffness is needed or not. So put your head back. And typically in the temple, I'm going to use reconstituted. It seems to give the right amount of lift. So I'm going to go right down to her skull. Just pull off it a little bit. We don't inject her periosteum. And just do a nice injection. And we're going to have you sit up for a minute. And put your head look straight into the camera. You don't have to look up. And you see how much her, I'm going to come around this side, but you see how much her face is kind of rotated up. Her steatoblephron is not even really visible anymore. Temple's filled out, seems starting to puff a little bit. Her mouth is lifted up on this side real smooth. Her chin is wider. Her mid-face is wider. And that's what it takes, is a lot of filler. You know, back in the day we were doing 3 syringes of filler. You couldn't possibly achieve this results, but that looks fantastic. So we're going to take offline and do the other side because we're going to be doing some training today, and then we'll do a before and after on the video.
To share with everyone my experience with this amazing, fairly new procedure that's called a magic lift, that is a non-surgical facelift. My skin was just, felt like it was just hanging off my chin, my cheekbones were gone. My eyes started to droop, and it started to just put an impact on how I looked, how I felt every morning, and I wasn't happy with my overall appearance. It was no more than probably an hour max between having part of my face numb with the numbing cream, which is fabulous, and then being injected in areas where I really needed help. I experienced just small pokes here and there as you were someone getting Botox, but the end result and the injections were so fast and so rewarding in the end to see the immediate results, even doing half of my face first, seeing the results, the difference. I was speechless. I still have a little bit of swelling. The swelling, you get some bruising. I had a little bit of bruising. They give you specific instructions what to do with your recovery process. I love my new face. I love my inner self again, and I look forward to coming into work and being out in public again and smiling as if I'm 10 to 20 years younger.